Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. I'm Samina Hashimi, editor of BJ Inform, and in each episode I chat with experts about topics across person-centered care, nurse well-being, and career development. Together, we'll explore their experiences and discuss practical tips and insights that you can apply to your nursing practice. Hello and welcome to the first My Career episode of Let's Talk Nursing, the BJ and Inform podcast. I'm joined today by Melanie Maddison, who's a lecturer in adult nursing at King's College London. She has 21 years of clinical experience in the NHS as a registered nurse in cardiology and emergency medicine, and worked as a matron during the pandemic before joining higher education. She's one of the sustainability leads in the Nursing, Midwifery and Palliative Care department and is currently leading educational reforms to reduce the carbon footprint of clinical skills teaching at the university. Thank you so much for joining me, Melanie.
Oh, thank you. Thank you, Samina, for inviting me.
So in today's episode, we're covering a hot topic that's being talked about in every sector, not just healthcare, and that's sustainability and climate change. But what is the link between sustainability and healthcare, and what role do nurses play in this? That's what we'll be discussing today with our guest sustainability nurse expert. Melanie has also written a really informative article about sustainable nursing practice and the environmental impact of healthcare on BJ and Inform. We'll include a link to this in the show notes. So this might just be me, but the healthcare sector isn't the first that comes to mind when I think of the biggest contributors to climate change. But in your article, you highlighted a really interesting statistic that if the healthcare sector were a country, it would be the fifth biggest emitter, which is huge. So what impact does the healthcare sector have on climate change?
Well, obviously, we have to think of this as a relationship with the planet, and hospitals and the NHS in particular is extremely resource heavy. Many hospitals are still reliant on fossil fuels to heat the hospitals, and clinical waste and the disposal of clinical waste comprises quite a large amount of very carbon heavy and, non-biodegradable items. It's really important for people in the NHS to realise that, as it's a large employee. I think it's 1.6 million in the UK workers. The impact of every day-to-day business is very large on the planet. So I think specifically, we use a lot of anaesthetic gases. They go straight up into the atmosphere if we don't contain them or we don't dispose of them correctly. So things like nitrous oxide used in, childbirth and dentistry and things like that, they go up into the atmosphere and they don't go away, and they contribute to global warming. And on top of that, if you think of a patient journey, if we take an ambulance to hospital and then we're in hospital, the hospital needs to be heated, medications need to be resourced, equipment might be coming from other countries to here. It's a huge burden that we have in the NHS, and we've got to maintain safety and standards at the same time. So I think that is how the healthcare sector actually is damaging the climate. So that's one side of the coin.
Yeah, and you mentioned one side of the coin there. To sort of flip that question on its head, then, what impact does climate change have on people's health?
Climate change has been described in the Lancet as the greatest threat to human health this century. And if you think about the health implications from extreme weather events such as flooding or forest fires, and the consequences of air pollution and water contamination on humans, you can see that already that if we damage the planet, we are damaging where we live and that biodiversity, and therefore our health is going to suffer. It is particularly prevalent in those who have the least. So in vulnerable communities that are in the developing world, they get hit the hardest. But we have had UK-based extreme weather events that have compromised our health. And, probably you could look at the beaches and not being able to swim in our water and things like this and say that it is having an impact. So really it's symbiotic. We have to improve how we look after the planet, and that will have a direct impact. For example, there is evidence of air pollution exacerbating respiratory and cardiovascular disease. It's also linked to cancers and things like that, which then means that people need hospitals more, which then means that the hospitals need to use more energy, which if they're not doing that sustainably creates more of a problem. So it's sort of it's a revolving door really, and we are all interconnected, and that's why it's important that we see the links both ways, not just in what we're doing to the planet, but also what the planet is then leading to increased hospital needs or health needs and our own well-being.
And that's really interesting as well, the sort of cycle of climate change and healthcare. It's a bit like, hospitals need to heat themselves and, burn fossil fuels to use energy, which then contributes to climate change, which then causes worse, adverse events, things like heat waves and air pollution, which worsens people's health and then makes more people go to the hospital, which produces more gases in turn. And then it's just an endless cycle of sort
Yeah.
of destroying the planet and people's health at the same time.
It is, and it's ironic when you think that for the medical profession, their mantra is "do no harm," and for nursing too, we are to reduce the harm. And in this instance, we aren't able to do that if we work in an unsustainable healthcare service.
Yeah, so almost the obligation to the patient creates this obligation to taking care of the environment and the climate as well. And bringing us back to sort of the healthcare sector's role in climate and environment, what actions is the NHS actually taking, in order to increase sustainability and reduce their carbon footprint?
Well, it's taken a long while and probably too long, but in 2022, the government recognised that this was a climate catastrophe, an emergency. It had a real sense of urgency, and they did that by embedding it into the Health and Care Act that year, which then led to a commitment from the NHS to reduce the carbon footprint of the NHS to net zero, originally by 2050, but then they decided that the urgency of it needed to be before that, so it's the 2040. If, in case the listeners don't know what that actually means, net zero, the term means that the emissions produced by the NHS need to be equal to or less than that they are taking from the environment. So that cyclical thing that I was talking about before, we will never have, a zero carbon footprint. Everything has a carbon footprint, but what we take out of the environment, we need to put back in. And that's quite an ask. It isn't just, plant a few trees and stuff like this. There is a lot that we need to do. So we need to move to what's called a circular economy, which is exactly that. What you put in, you put back. And it means that you have to live and work by the principles of sustainability. So you have to move to using more sustainable energy resources. You need to reduce the amount and the nature of the waste that you are producing. And that sort of goes hand in hand with things like sustainable procurement. Where are we getting this stuff from? So a good example that has already happened is that the NHS fleet of vehicles have become electric. And transport was a huge, obviously, if you think about it, if it was all petrol or diesel, then, that would have been contributing to the air pollution. Something like that is a very positive step in the right direction. Every trust now has to have a green plan, and that green plan sets out the local actions required for that particular organisation and workforce in order to reduce the emissions. And that might mean that they use local suppliers, or they may use other equipment to capture, say, for example, the anaesthetic gases, so that they don't go into the atmosphere. Particularly if there's a lot of surgery going on. So a lot of trusts are getting to grips with that, perhaps using some quality improvement to make local changes and involving patients as well. It's always really good to involve patients and what they want. There is also brilliant things like the NHS forestry scheme where they are planting trees because obviously we know that they absorb the gases. So if you can plant a tree, it sounds very trite, but it is an amazing thing to do. Although the NHS will need quite a lot of trees to balance its books, I feel. But yeah, so these are sort of positive things that the UK-based NHS and local trusts are doing.
And you mentioned there briefly about sort of involving patient voices and what patients want to do. So, what role do patients play in organization-wide changes around sustainability, and are they involved in this? in these sorts of actions?
Yes, I think it's really important because it's part of the self-management, it's part of the idea of health promotion that what we ultimately want is people not having to rely on hospital. So if you've got a long-term condition, you don't want someone to, for that to deteriorate where they need to come to hospital more frequently. So if you engage patients and you say that anything that improves the environment and improves their condition, you can sort of persuade them that they have power in this. So if they say, right, well, I don't want to take, I don't want to use this type of inhaler, is there a different type of inhaler, or where can I put these medications, or should I just put them in the bin, or should I put my tablets down the toilet, or something like this? Then if you give them the power to know what is happening in their NHS and where money is perhaps being wasted or things are being wasted, you might find that they care so much about the planet themselves that they want to do it. And whatever they do, like I keep saying, my mantra is if it's good for the planet, it's probably good for your patient. And therefore, it is really important. But you can't just do things without, you can never do things just without asking patients. It's a really, it sounds simple, but if you miss them out of the equation, you probably aren't asking what matters to them. And initially, they might not want to change. They might think that, well, no, I want an ambulance to come and get me, or I want to go to hospital and see my consultant. But if you explain to them that, if you could have the care at home and you could have it via a tele kit, you'd get the same treatment. You'd probably be seen more often, and you wouldn't have to come to hospital and sit for hours and use the energy of that thing. So I think it's like everything, you have to engage the stakeholders. So I think that's really important, and nurses will be at the forefront of that because we are the ones advocating. We're there 24/7 with our patients. It is really important that we talk to them and involve them.
Yeah, that's really interesting that there's sort of two sides to involving patients. On the one side, there's the literal, this is what you can do with your medication, with the supplies that we gave you, this is how you can recycle things. And then on the other side, there's the things that you can do to benefit your health, will not only benefit your health, but also benefit the environment. So it's almost like a two birds with one stone situation. And you mentioned there about nurses obviously playing a huge role in having these conversations with patients. Aside from sort of patient education and role modeling for patients specifically, what else can nurses do to promote sustainability?
Well, I mean, we're all, professionals, but we also have a personal connection with nature. And it may be simple things on a personal level, like bringing a cup to work rather than using, single-use plastic to take your meals with. It may be that you cycle to work, or you car share, or you perhaps change your diet to plant-based diets. All these things, they're personal choices, and they're things that somebody could do. I understand, obviously, sometimes people get what's called eco-anxiety because they see this big, wicked problem of, climate catastrophe, and they think, what on earth could I do? But if you can say to people that even the smallest of individual actions collectively will make a big difference, and they will help, not only that person who's made those changes, but also the overall picture that we have of climate catastrophe. So there's things like that. I mean, they're role models to students. I work with students all the time, and they want to see best practice. They want to see best evidence-based practice. So if your nurse is showing that she understands sustainability, then what a brilliant mentor, or preceptorship for that student, because they're looking and they're seeing what it looks like in practice, and being respectful of that. So, but obviously any kind of health promotion, if you think about it, smoking cessation is perfect, isn't it? You talk to the patient about it, and it has instant benefits for them. But if they care about the environment, and you mention to them, did you also know that it's going to help with air pollution in London? Then they might be excited to know that they're contributing in that way as well. They might have thought that it wasn't worth their effort. So I think there's ways to talk about that. And I have mentioned in my article a wonderful communication toolkit by the World Health Organization. It's very easy to read, because I realize that the listeners may think, well, I don't know anything about the climate crisis. I'm not a scientist. You don't need to be a scientist. You just need to be a nurse, because virtually everything that we do is probably going to be good for the planet as well as our patient.
Yes, and I can include a link to the toolkit in the show notes as well if any of the listeners want to look more into that. And you also wrote in your article about the quantity of personal protective equipment or PPE that was used during the pandemic and how this had such a big toll on the carbon footprint of the NHS. Could you talk a bit more about the role that PPE plays in sort of sustainability and climate change?
Yeah, so I mentioned there were some hotspots within the NHS, such as anaesthetic gases and medicated pharmaceuticals and single use items. PPE represents one of those major hotspots. When I was working in the pandemic, obviously we went, overnight into covering ourselves in, mountains of PPE, which was, masks of all different kind of materials. There were different types of hazmat suits. There were aprons, gloves. There was double gloving. There was goggles. You name it. And obviously, we required it to some degree because of the way that the pandemic was very quick and very deadly. But it was used rather indiscriminately everywhere. And obviously, the public were using it as well and not disposing of it correctly. And there have been horrific videos of masks floating around in oceans. But for the NHS, it just meant that the quantity of PPE that was clinically contaminated and needed to be incinerated, which obviously causes huge amounts of air pollution, went up exponentially because of the pandemic. And there was a paper by Chantal Rizan who looked at the carbon footprint in just the first 6 months. And she estimated that the carbon footprint was the same as 244 return flights between London and New York in the first
Which is
6 months.
insane.
Yeah.
Yeah, return flights as well.
Yeah. So, it represents a huge amount. And obviously, at times it is our best friend. But what's quite refreshing is now in connection with people like the Royal College of Nursing and infection control teams, we are being invited to use PPE with intention and consideration. So yes, of course, there are situations where you need to use it if you're anywhere near a blood products or anything that's contaminated, or if the patient, might catch something the other way. But infection control experts are saying that the use of PPE actually stops people washing their hands properly. And it actually means that you're more likely to transmit if you're using it inappropriately. And they've sort of tried to do, it's called the Gloves Off campaign, and it's fantastic. And I just think because it's endorsed by infection control, that means that the nurse on the ground doesn't have to worry, well, am I doing this right? But it asks you to do a risk assessment. Do I need to put some gloves on? Do I need an apron here? Do I need things like that? And that's really important, that we relook at the way that we're using it, instead of, in some areas people were double gloving, what's that all about? So there's lots of things that go on that would not be endorsed by an infection control team, and that's so that's very significant. So if we can reduce the number of PPE that we use and only use it, so a good example is if you see somebody perhaps doing a set of observations on a patient that's not got an infection, they don't need to wear gloves. They just need to do the observations and clean the equipment between people, or making a bed that's already clean, with your gloves on. And maybe sitting doing their notes. And it's not just nurses. I say this in all honesty. The people that I've seen wearing gloves and PPE inappropriately are very often not nurses. But it's just something that we need to consider, and we need to look at the quantity, because they are very difficult to dispose of. Some areas in surgery are using a reusable PPE, so stuff that can be washed and reused. They still have a number of times you can use them before they're no longer suitable for that purpose. But you are cutting down on the amount of stuff that's going off in a yellow bag and being burnt somewhere, and contributing to the overall climate crisis.
No, and I love that statistic about the return flights. I just think that's insane. 244 return flights from London to New York, and that's not close. And everyone thinks of aeroplanes as the biggest, carbon emitters, but healthcare equipment is clearly right up there.
I think yes, we have our flight our flight badge at this stage, really. But yeah.
And What have your sort of personal experiences of being an advocate for sustainability in healthcare been like so far?
I think it's really taken off since I went into higher education and started working with the next generation of nurses. I noticed when I was teaching clinical skills to them that we're using the same equipment that we use in clinical practice, but we're using it on clean dummies that do not exude anything. So therefore, it's not actually contaminated, and yet we were putting it in the bins, in yellow bins, obviously to teach students what to do, and that was getting collected as contaminants and being burnt in the same way. And on top of that, you get people using, in practice, you obviously only use something once with one patient. But if you're using the same dummy, there's no actual risk to using the same piece of equipment just to get it right. So the idea of using, say, 13 catheters per student for each attempt at catheterization is not really sustainable, and it creates an awful lot of waste. So I think that because we have to give authentic opportunities to students, and they're the brightest, they think of these things themselves as well, and they realize that there's a problem, and as long as they can practice the skill safely, they realize that actually they don't need to use a huge amount of resources. So that's something that's really interested me in my current job. um, Obviously in my past job, it was more around wide open spaces and green spaces. So when I was matron, obviously even prior to the COVID pandemic, the well-being of nurses and medical professionals was always very reasonably fragile. And there's a lot of work to be done that actually, if you allow us spaces in our workplaces which are green, and you allow us exercise and walking around and things like that, that can have a huge impact on people's mental well-being, and help keep them in a better place, or at least be able to decompress when they're working in such a high stress environment. So yeah, I mean, there's a lot of it is connected.
Yeah. And just sort of out of curiosity, how did you fall into the sustainability sphere?
I'm a bit of a I'm a bit of a recycler, and I've always I can't bear to throw anything out, which is probably not helpful for my house. But I can't stand sort of waste, and I used to do vintage clothing, and I love secondhand clothing, and so from a personal point of view, I adore this. I think this is just so good. I've got children, and I worry about the future as well for them, and the planet, and I want nature and all these beautiful things to still exist. But I also love the NHS, and I just find it really interesting that we have to think about this. It's not very straightforward, and we've got to take every opportunity we can to try and undo some of the damage, and in fact make the NHS better, because even today, even listening to the news conferences, they're saying that the NHS is not currently, they keep talking about it as broken. Whether you agree or not, it definitely could do with some help to make things sustainable. And if you make things environmentally sustainable, finance will follow, and good quality care will follow. So I'm kind of hopeful it's the way ahead, really.
And sort of on that note, obviously, sort of organization wide and government wide, people have been taking climate change more seriously, and sustainability has, come to the forefront of key actions that need to be taken. But do you feel like nurses' attitudes around climate change have changed since you've been working in that sphere?
Definitely, definitely. I've been to some conferences where I've met nurses who they're passionate about this. They would like to change things because they can see that urgency. They can see that the future without a planet that's working is no good, and that all these health related matters are really important. So absolutely, and there have been a lot of sort of recent articles in journals to say that it really matters to nurses. They do care about the planet. Of course, they care about the planet, and therefore they don't want to keep doing harm. And it would put us into conflict, really. You can see already that there is sometimes conflict where people have to go into activism, and that might go against maybe your professionalism, but it's because you don't want it to continue. So yeah, I think there's an appetite for it, definitely, amongst students and nurses who are also working now, because they can understand the impact that it's having.
Yeah, amazing. Thank you for sharing that. Moving on to our three key actions, this is a segment where I ask our guests to outline three important practical actions that nurses can implement into their practice. So, what is the first key action that nurses can take in regard to upholding sustainable practice?
I mean, the first thing you could do is go and ask your trust to see the green plan, because the green plan will only work if everybody knows about it. So it doesn't matter where you work. Go and ask the trust that you are in what it is, and perhaps you might be able to see what work is going on, and if you can join that, or have ideas or be asked your opinion. That's a really, really good way of even getting to understand what the local problems look like and what is being done. So I think that would be the first thing that I would perhaps ask people to do. And then really it depends on your clinical practice. But if, for example, something like the RCN Gloves Off campaign wasn't implemented yet in your trust, then that's something that you could suggest starts to be used, and just on a personal level, intentionally using it yourself and asking yourself the question, do I need to put these gloves on? Do I need this apron as well? That would be the second thing I would start to do, because as we've established, PPE is one of the big ones that you can do something about. And then, like I say, just when we go to work, sometimes we don't do things because things aren't in place. So, for example, when I open up a piece of packaging in a wound care pack, the back of it is made of paper that can be recycled. But if I haven't got a recycling paper bin near me, I probably put the whole lot into the clinical waste bag because it's easier for me to do that and I'm a busy nurse. So maybe it's a question of sometimes looking at things and asking managers, asking people, why don't we have that bin there, or why don't we do this like this, or you are allowed to, you're not being a troublemaker as a nurse if you actually say, I can't do this because this is the barrier to this. So yeah, it's just really about rethinking what we do and why we do it, and
Yeah.
don't put anything except sharps into a sharp bin. It's an ongoing problem where obviously that goes and gets burnt. So if it's full of people's sandwiches or giving sets or something, and not just needles, you're having to burn a whole lot more sharps bins. So yeah, be a
Mm.
sharp bin police.
Use the right bins, everyone.
Absolutely.
No, and definitely the point about removing simple barriers. I mean, I feel like even for myself, I don't feel the need to recycle things if I don't have immediate access to a recycling bin, and it just feels that much more complicated. Like I'm putting in that much more effort to do this one simple thing. So yeah, just having the right bins around in the workplace or even at home is just really helpful to just do it without having to think about it, really.
Sub-trusts have changed. So, for example, they were feeding patients using plastic cutlery, which they were then disposing of. So they've gone back to, normal cutlery, or they're using the bamboo stuff that does biodegrade or whatever. So you might not be able to, as a just one nurse, do this, but if you make the suggestion, and particularly if somebody tots up the figures, if it costs less, they'll probably implement it. They haven't got that much money to be spending. So yeah, it works very nicely if you feel that you want to have a voice.
It's sort of, yeah, very, very logical, but then at the same time, I guess it takes a bit more effort to implement these things. So, yes, thanks so much for sharing those actions. They sound like really helpful steps for nurses who, I guess, want to find out more about how they can get involved in sustainability as part of their jobs. Now, to wrap up the episode, we're going to look at a couple of scenario-based reflective questions. I'm going to read out two scenarios that a nurse might encounter, and we'll then discuss how you would approach these situations with sustainability in mind. For our listeners, feel free to pause the episode and think about what you would do in these situations, and then press play to hear Melanie's approach. So, the first scenario is you have just started working on a new ward and have noticed that many of the practices on the ward are unsustainable and unnecessary. For example, the sheets on the beds are changed every day, even when they're clean, and there is excessive use of gloves and aprons as well as double gloving. You want to speak to your colleagues about these unsustainable practices and suggest some practical changes. How would you go about doing this? So, before recording, you told me about an experience you had around changing bed sheets. Could you talk to us a bit about that and also how you would approach this situation?
Yes, so thank you. Yeah, this happened to me on one of my first wards. The sister on the ward had actually noticed how all of the patients were getting new sheets every day, regardless of their condition or need for it. Even if they were going home that day, they got a new sheet. So she kind of pointed out that we don't normally change our sheets every day when we're at home, and obviously there are very good reasons for changing sheets. But she said to us, and the way she did it was so brilliant. It was actually engaging us. She said, could we ask the patients if it was okay, or if they didn't mind having the same sheets? If they said no, they wanted new ones, then they could do that. So it sort of took that fear of they're going to blame us for not changing the sheets, because that was sort of the major resistance that we got. And she did this as well by telling us that she'd counted when she arrived, they counted the number of bags of linen that were leaving the ward every day. And she'd asked estates how much that cost in terms of laundry, and then discovered that they get taken off site in a lorry to be laundered and then brought back by another lorry. So the more that you're doing, the bigger the carbon footprint. So if you don't need to use as much laundry and get that done, obviously it's got this massive impact. And it sort of it also involved always only putting contaminant laundry into the right bags, because that's at really high temperatures, which is really bad for the environment. So I think that it depends on how you feel. But what I always say is start the conversation with people, even if it's just in the coffee room. If you find a like-minded, you say, oh my goodness, I can't believe everybody does this every day. Is why they do that? And just have these kind of things. You might find out that other people are, inside they're eco warriors, but they didn't know that anybody else cared. And the more we discuss this, the better it is. I have a saying myself, that I'd rather break the ice than melt it. So for that,
Mhm.
I want to talk about these things and avoid the catastrophe that we have. So I think that just have the conversations with people. They might think they can't do anything, but collectively, even if you're the junior nurse there, you could then go to the ward sister and say, hang on a minute, do we have to do this every day? Could we help the ward budget? Could we help the patients? Could we help ourselves and the planet? And see how that lands. And you might get a little bit of resistance at first, but I think figures talk. And you can prove it as well. So a little bit of digging. Most estates people are fantastic. You potter down to wherever they hand out the venflons and the procurement bit, and you ask them questions, and they know, because they're the ones with the contracts. They know how much everything's costing. So if you need to convince somebody that it's not just an environmental cost, then that's always a really good idea.
Yeah, and I think that is the point, isn't it? Just having communicating with both colleagues and also the patients, because that in
Mm.
turn then motivates people to actually make these changes and see them as something that's more realistic and
Yeah.
sort
Most
of
of the patients were fine with it as well. There was very
Mm.
little resistance, because and sometimes they wanted to help us with the, I don't know,
Oh.
it's quite sweet, really. But yeah, no, always talk to people, just, to see, because otherwise you're just in a silo and you think you're the only one, and therefore you can't solve anything. And it's
Mm.
always better as a collective.
Yeah, work together as a team, definitely. Well, that's a really amazing example. Thank you so much. And the second scenario is, so your patient has asthma and feels that this is being exacerbated by living in a busy city, but isn't sure what to do about it. How can you explain the contributions that air pollution and climate change are having on this patient's asthma? And what advice would you give to this patient in terms of avoiding worsening symptoms? So, what would your approach be here?
I think one thing I've learned is that you can't turn people's minds, you can't make people believe things. And I heard of something the other day that was really, really helpful for starting any conversation, not just about the environment. And that was, instead of asking a patient, what's the matter with you, i.e., you've got asthma, ask them what matters to them. And if you can get that into the conversation, that you're going to talk about the environmental impact of, say, asthma and inhalers, then you've got a way in, because they might actually be, interested in it themselves. So it's back to that sort of asking them whether they care about this, or whether it's of interest to them. Because obviously, if they've got asthma, then they have difficulty breathing at times, and that's very, very scary. And they may not be able to change where they live, so they might be feeling quite disempowered. And part of sustainable quality improvement is health promotion and empowerment of the patient to take control of their condition, if particularly long-term conditions like asthma. So then once you've sort of talked about that, you might be able to explore the different types of inhalers. So the propellant inhalers that we used to use for everything are very, very bad. They contain CFCs, which are really, really poor for the environment. And some conditions you can't change inhalers. But if you've been able to involve the pharmacist or the consultant or somebody who's a prescriber, if there's a different type of a powder type of inhaler, that has a much lower impact on the environment. And the patient might feel good about that in terms of, oh, well, at least I'm not, damaging other things as well. And if you make that connection early on as well, that air pollution is contributing to their condition. So if you reduce things, like the inhalers, then the environment will improve and their condition may improve. You could explain to them that sort of that symbiosis or that circular idea as well. The other important thing is obviously talking to them about their lifestyle, because perhaps there are things that they could mitigate. Now, not everybody can, but if they live somewhere where there are smokers and things like this, you could ask, do they want someone to come and ask those people about their lifestyle? But it could be something as simple as they have a petrol car, or they use a gas fire in their own home and things like this, which could they consider alternatives? It's not always financially doable, and I know those conversations are different. But if none of that is applicable, what about actually getting out to green spaces and parks and fresh air, where perhaps exercise, pulmonary rehabilitation, some exercise will help them to maintain their condition, and self-manage it, and for to avoid hospital visits and complications. So it's sort of having those conversations with patients. And I think as well, they don't want to come in for 6 different visits to the hospital. If something can be done either in their own home, or if they do things, all in one-stop shops, they're really good ways to kind of manage them. So maybe when you're talking to that patient, they might say, oh God, I hate going every month to the hospital. Is there an alternative? And you didn't know that they wanted that. As well, you can put them in touch with support groups of other patients. And social isolation, you wouldn't think it was necessarily involved in the environment, but the impact, if you improve the environmental impact, you will improve the social aspect as well. So you don't want people like who live alone becoming lonely and only wanting to go to hospital because of the loneliness, not because of the condition. So sometimes respiratory conditions can cause patients to come into hospital very frequently. And again, as a nurse, I would be addressing things like that to make sure that they could have the confidence to talk to other people, have a bit of social interaction, and not necessarily have to rely on hospitals as the go-to place for everything. The other thing is obviously talking to them about disposal of any kind of medications, whether it's medicine bottles, taking them back to the pharmacies who have proper recycling systems for things like blister packs and inhalers and things like that, so that they don't get incinerated and the gases are safely taken or extracted from them.
It's really mind-boggling how many aspects of patient care are integrated into sustainability as well. I mean, like you were saying, I never would have thought that social isolation had much to do with sustainable practice or, being environmentally conscious, but it really does. I mean, it's insane how everything is so interrelated, but really interesting to think about how all of these factors play together.
Thank you. And thank you for letting me talk about it.
Yeah, and thanks so much for joining me on this episode of Let's Talk Nursing, Mel. It's been such a pleasure talking to you about, sustainable practices and what nurses can do about this.
Thank you. It's been a great opportunity.
Thanks so much. If you enjoyed this episode of Let's Talk Nursing, do follow us for new episodes and share with your colleagues. For more resources and past episodes, visit bjninform.com. Thank you so much for listening and see you next time.